Hi, my name is Shaji Kumar. I'm a hematologist at Mayo Clinic in Rochester, Minnesota. At this recent ASH meeting, we looked at the treatment patterns amongst patients with translocation 1114 multiple myeloma. As you all know, translocation 1114 occurs in about 15 to 20% of patients with multiple myeloma and has become a subgroup of patients where a specific therapeutic option is being studied and has been shown to be quite effective, which is venetoclax. Now, venetoclax is a BCL2 targeted small molecule that has been shown to be quite effective, and especially when combined with dexamethasone or dexamethasone and bortezomib and other standard of care agents in patients with translocation 1114. Given this finding, there has been significant interest in trying to understand the natural history of patients with translocation 1114. This particular analysis that was presented was done using patients that were part of a multi-center retrospective study by the International Myeloma Working Group. So patients who were diagnosed between 2005 and 2018 and had at least one line of therapy were included in this analysis. The primary goal of this particular analysis was to look at the treatment patterns and its variations over across different geographical regions. So we specifically looked at the treatment patterns and outcomes in patients treated in the US and also Western Europe and Canada, and the third group being Japan and Asia Pacific. Overall, 1,048 patients were studied, with nearly a third of these patients each from these three geographic regions. The distribution, the ISS stage and other baseline characteristics were fairly similar across the three groups. When we look at the treatment patterns, the most commonly used combinations included either proteasome inhibitor or an IMiD with steroid, or a proteasome inhibitor along with an immunomodulatory drug in combination. Now, there were clear variations in the treatment patterns across these geographical regions, with the three drug combinations increasingly being used in the US, with less of the three drug combinations, or at least the IMiD and PI combinations in the other two regions. And these patterns persisted across the first three lines of therapy. And when you look at the response rates, again, these were very comparable across these different regions in the first three lines of therapy. Now, we also looked at the survival outcomes, and when you look at the progression-free survival, it certainly appeared to be longer amongst the patients who were treated in the US compared to Japan and Western Europe and Canada. Part of this is likely related to the increasing opportunities for patients with relapsed disease to go on a variety of different clinical trials, especially the immunotherapy trials. These data provide a good benchmark as we look at design of clinical trials with a variety of different standard of care agents in combination with venetoclax in these different regions. Thank you.